everyone, I'm Dr. Stephanie and I'm a physical therapist. And today I want to talk to you about the number one most important muscle to strengthen if you're looking to get rid of your low back pain, your SI joint pain, and even your hip and knee pain. We're going to go through what this muscle is, why it's important, and I'm going to show you 5 different strengthening exercises for this muscle. So to start, this muscle that I'm talking about is the gluteus medius muscle. It's a muscle that comes across your butt here. So it starts up at the top of the pelvis, comes down across here, crosses your hip on the outside of the joint, and then attaches to the femur at the greater trochanter. The greater trochanter is just a little notch on your femur, and you can kind of feel it if you push into the side of your hip. It may be kind of tender, it may be sore if you lay on that side for a long period of time. And so that's where that muscle attaches. There are 2 functions of this muscle. One function is to do hip abduction, and that's just bringing your leg out to the side here. Or if you're laying down, it's laying on your side, lifting your leg up towards the ceiling. And the other function, which is probably the more important function, is to stabilize your pelvis. So most of the movements we do, or a lot of the movements we do, are single leg movements. So even when you're walking, you have to be stable and secure on one leg because every step you take, you're on one leg. So when you're on one leg, that gluteus medius muscle stabilizes your pelvis so that it stays even like this. If that muscle is not strong, when you're walking, your hip's going to drop just like this. So you may have kind of a weird gait if that's happening. You may kind of sway your hips because that muscle is not strong, so it's not stabilizing your hips. So it's really important for that muscle to be strong because if it's not strong, that puts extra stress on your spine, on your hips, even your knees. Because, if you're walking and that muscle's not strong, your hips dropping, that just puts more stress on your knee joint. It makes your back kind of get out of its proper position. So it just makes everything get out of alignment and it can make things hurt. So if you can strengthen that muscle, it can reduce back injuries, hip injuries, knee injuries. And if you're having any pain currently, strengthening and stabilizing those muscles will help to reduce that pain and get rid of it. So I'm going to show you 5 different exercises that have been studied by research to be shown to have some of the highest muscle activation in that muscle. So all you need, I'm going to use this plyometric box I have here, but you can use a chair if that's all you have, or a bench or a bed or whatever you have. So we're going to do 2 exercises with this, and then we'll do 3 exercises on the floor. And so all of these exercises, you can do 2 to 3 sets of 10. You can add them to your routine daily, or you can do them every other day. But these will help really strengthen that muscle and really help reduce your back and hip and knee pain. So we're going to start. We're going to do a single leg sit to stand. So you're going to stand on one leg, and you're just slowly going to lower yourself down to the chair or the bed or the couch or whatever you have, and then stand back up. Now, this is a pretty difficult exercise, but what you can do if that's too difficult, obviously you can start with 2 legs, or you can sit down with 2 legs and stand up with 1 leg, or if you can do sit down with 1 leg, stand up with 2. Those are some different variations you can do. You can also start with like a higher stool or higher bed, and so you don't have to go down quite as far. And then once you master that, you can start gradually decreasing the height of the chair. So basically you're just going to sit nice and slow. You don't want to plop down, and then stand up slowly as well. You may have a little bit of wobbling in your knee and your leg and your foot, and that's okay. You do want to try to stay level though. So you don't want to tilt to one side or the other. You don't want your knee to come in like this. You want to try to keep your knee and your foot straight. Just gradually sit down and then stand up. So 2 to 3 sets of 10 on each side. And then the next one we're going to do with this box is do a step up. So you're going to just step up to the side and then step down. Now, if you're pretty advanced, you can go to this step, but if you're a beginner or you try a higher step and it's really tough, start with just a stair, like the height of your staircase. So maybe like a 6 or 8 inch step, and just step up to the side like this, and then back down. You can also step up on a book if you want to start really slow, and then just gradually increase the height. When you step up, make sure you step and keep your toes pointed straight ahead because that's important for making sure you're working the right muscle. And then step up here. And then when you step down, you want to go nice and slow and keep that knee pointed straight. You don't want it to come in or out. But definitely this is an advanced version, so you can start with a smaller step. But 2 to 3 sets of 10 on each side. And then let me move this box out of the way. Okay, then we're going to go on the floor for the next 3. So we're going to start on our side. So you're just going to lie on your side, bend the bottom knee, straighten the top leg. And now this is really important that you keep this leg in line with your body. So you don't want it to be up here. You can have it back a little bit, but you don't want it to be too far back. And you don't want to rotate your leg up either. So you want to keep your toes pointed straight, leg in line with your body, and you're just going to lift up to about here. You don't want to lift too high, then you're using some different muscles. And then you're going to come back down slowly. So you're just going to lift up and down. Some people find it, if you have a wall or you want to do it next to a wall, you can kind of guide your heel along the wall, up and down. You want to make sure you go slow and keep your toes flexed back towards you and pointed straight ahead. So you don't want to rotate them up or down. So just up and down. 2 to 3 sets of 10. If this gets easy and you have ankle weights, you can put a weight around your ankle and do the same thing. All right, then we're going to make that a little more complicated. We're going to do a side plank, kind of a modified side plank. So keep the bottom knee bent, come up on your forearm. You're going to lift your hips, and you're just going to lift your leg up off the ground and back down. So this one's a little tougher. This may not be the first one you try. But when you get good at the other one, you can move to this one. So you want to try 2 to 3 sets of 10. You can even make it more challenging and eventually do like a regular side plank and lift your leg up. But that's a much harder way. So if you can't do that one with proper form, then I wouldn't do that one. You can try all of these other ones first. Okay, the last one I'm going to show you, you're going to get into a plank position. So you're going to plank here, keep your back flat. And you're going to lift one leg up off the ground, lift the other one. You're just going to alternate back and forth. Just like that. That one you can do 2 to 3 sets of 10. You can also, if you want to do it like for 20 or 30 seconds, you can just go for that amount of time and repeat that, maybe 3 sets of that. But all of those exercises will be great for increasing that gluteus medius strength, and it'll help you keep that level pelvis. So when you're walking, you walk straight like this, and you don't have that little kind of like hip drop as you go. And so strengthening that muscle will help relieve back pain, relieve SI joint pain, hip and knee pain, and sometimes even ankle pain, because if your ankles are unstable, it's important to really work on that balance and single leg stability. So that muscle, that gluteus medius muscle, is super important to strengthen. Try all 5 of those exercises, and hopefully that helps your pain and helps prevent injuries in the future.